good afternoon to all. That my first words be to thank you for this very great honor of an invitation to be here in this forum of technical cooperation on human milk donation, the lessons we learned during the pandemic and what we can do more. I'll ask the organization to give me permission.
A gente fica sempre na expectativa de saber se estão
We're
vendo.
always in the expectation. If you're hearing us, is everything okay? Yes, Dr. Antonio. I would like to say that I'm very honored to be here with you, representing Secretary Rafael Câmara, which is the Secretary of the Primary Care of our Minister Queiroz, which will be at the end of our event, making the national campaign, starting the national campaign for donation. I'd like to thank Janine from DAX, that with her technical team helped in thinking up this presentation. We are facing the greatest health crisis of the world. Since this disease came to Brazil, the Department of Programmatic Actions and the Ministry of Health were concerned the data connected to birth, to breast milk, and I will focus in some factual elements in the timeline of Brazil of how we articulated the management of the federal government with the promotion of breastfeeding during the COVID crisis. And I remember the new infection by the coronavirus was declared an emergency of national importance. A month afterwards, the DAX does a technical note jointly with the Brazilian HMB network, the Pediatrics Association, a medical association, the Brazilian Association of Obstetricians, and the national network in the defense of the right to breastfeed, saying that it was safe even during the pandemic. A week afterwards, we had the technical note number 5 as regards doubts on the donation of breast milk in the context of COVID-19. This is interesting because you can only donate milk if you're breastfeeding. So the 18th March note saying we should incentivize breastfeeding, and once they are breastfeeding, they can, as an act of solidarity, having the security of donating milk to the milk banks. On the 3rd of April, we had a technical note talking about care on the health of newborns in the context of infection. So strongly thought by the Society of Pediatrics of Brazil and other institutions connected and the academia, showing the joint of action of good practices that should support breastfeeding, highlighting the skin-to-skin contact of the little baby and clamping of the cord at the opportune, starting at half an hour, 1 hour of life, even during the pandemic. And this was fundamental to guarantee that the prenatal and maternity, that this was, and to start precociously to guarantee the good practices of births, even in the context of the pandemic. On the 3rd of August, we launched a technical note where we presented frequent questions, FAQs, as regards of COVID-19, adapted from a WHO document. And it is fundamental to say that there was an update of the technical notes, emphasizing that breastfeeding and human milk donation. In that same month of August, the DAC-SACS presents a manual with recommendations to help pregnant women, as in the post-pregnancy due to COVID, emphasizing hygiene of hands, use of mask, and keeping the contact of the mother with the baby. Even those that have any kind of symptom, keeping a safe distance from the kid, they could breastfeed using a mask and good hygiene of the hands, and avoiding any kind of transmission during the act of breastfeeding. In the same month of August, we presented to the social, the Brazilian society, the prevalence of breastfeeding between kids under 6 months, showing a robust and sustainable breastfeeding, exclusive breastfeeding, at least to 6 months in our country. And it's not the pandemic which will represent a setback in this right that is guaranteed to our small Brazilians, in the same way that we support our mothers to breastfeed their kids. Here, I'd like to bring to the timeline in Brazil a technical note, 11th of March, recommending vaccines to pregnant women, posts, and those that are also breastfeeding, including clarifying that they should be a priority group with the National Program of Immunization, and that they should vaccinate these women if they have some clinical risk. It's not only of these notes that we support those women who want to breastfeed. I brought here 3 decisions that mean millions of reais that support to those who had recently given birth, that they have the right to breastfeed. These are directives that allow to renew the structures of the maternities, purchasing equipment and material that are fundamental to good practices, and therefore we can create an ideal environment where breastfeeding can happen in a safe manner. And almost finishing here, the investment in HMBs, over 10 million reais, which we managed to renew equipment of 81 HMBs in Brazil, as a clear initiative to show the importance that this management of the Ministry of Health sees or how they see as important the human milk donation. The main points and recommendations from Brazil: we recommend that breastfeeding be kept in the cases of infection by COVID. If the woman desires to breastfeed and is in adequate clinical conditions, cleaning her hands, and using masks. If she doesn't feel safe in breastfeeding while she has coronavirus, we recommend that the milk be extracted and offered to the kid in a little cup because the chances of transmission through the milk are negligible. Only healthy women can donate since it's not indicated any kind of fever or any COVID that is confirmed. This is for women who have had cause cases or exposition or have had COVID. As regards the milking, it is sufficient to guarantee the biological security of the professionals and of the product, since the pasteurization makes that milk safe to be offered without adding new stages to the processing or collection. The vaccine should be offered to those women who are breastfeeding as recommended in the national plan. And in this moment, are breastfeeding women identified, and these should be oriented to not stop breastfeeding even if they're vaccinated. Even after the vaccination, they should continue to offer milk to their little babies. So this support is important to keep and increase the donation of human milk. The COVID-19 pandemic will not be a reason for a setback in the high rates of breastfeeding by Brazilian women, because this is an important signal of citizenship to our little Brazilians. Thank you very much for the opportunity to be here. And I will continue after this presentation, where I'll go to the Ministry of Health, where next to our minister and our secretary, we will participate in the launching of the national campaign to give incentive to breastfeeding. Thank you very much. And let's continue with this program, whose execution is already a success.